And new tonight, pharma giant Pfizer says their vaccine is farther ahead than others. News 2's Kate Prestak spoke with those at Roper St. Francis to hear what this news means and how long we may have until a vaccine is available to the public.
With a 90% efficacy, Lowcountry doctors telling me that while they are excited and hopeful for the new COVID-19 vaccine out of Pfizer, they also understand that more has to be done in terms of the study. The first step, increasing the number of patients participating in the study.
They're still not to the infections that they need. They still have to get to, I think it's like 160 or some infections.
Dr. Robert Oliverio, the Chief Medical Officer for Ambulatory Care and Population Health at Roper St. Francis, says, per the FDA's vaccine guidelines, a certain number of infections in the study are needed. But as the study progresses, manufacturing has started.
This is one of the things that's a big difference in this COVID-19 vaccine is, they weren't sure if it was going to work, but for each of these vaccines that they were developing, they were producing it. So there'll be a lot more availability of vaccine, but it's still going to have to be sort of a stepwise rollout.
That rollout believed to be given out in a priority basis, with those most at risk and in healthcare receiving the vaccine first.
Working, sort of generally in the workforce, you may not have access to the vaccine for several months after it's released. But that's the way this is going to go. Hopefully, we'll be able to get everybody vaccinated sometime in the fall. That would be great.
Dr. Oliverio says that until a vaccine is rolled out to the general public, that herd immunity is accomplished through vaccinations to make sure that you're still wearing your mask, social distancing when able to, and avoiding large gatherings. In Charleston, I'm Kate Prestak. Count on 2.